right. This is round two of conversations with Gil Bashe, my good friend. We had some good conversations earlier this year, a lot of predictions, kind of the deep, what he was seeing, what he would like to see focused on and healthcare. I think there was a top 10, but I think this is very much important today. I'm so glad you're on, Gil. And this was really prompted by your article that you posted. I know everyone knows you, but just really quick, if you want to do a quick intro before we get going, would be great.
That's an embarrassing question, Michael. I think when you have a little white in your beard, as I do, you've had a chance to do a little bit of everything. But I'll touch on some of the high points I think that are relevant to this conversation. I was talking about and writing about digital health as far back as 1995, when digital health or AOL was really just on the landscape. I wrote my first article about how people with chronic conditions would unite using the internet. That was a breakthrough article, actually, and prophetic in a way. And then I started to explore the world of digital health in between 1995 and 2000. I started to meet with the first people who came out. They didn't call themselves digital health companies at that time. They were doing health internet. But I certainly was watching customer relationship management techniques that have evolved into digital health marketing today. So that's about 25, 30 years ago. That's freaky. But I've also been a CEO of a large integrated marketing health company. In fees, a little more than north of $200 million in an early period. And then I went to private equity. I was with a group called GT Goldner Radner. And today, obviously, it's a significant VC private equity group with about $10 billion in active management. And from there, I did a series of turnarounds. But I guess you could say my love affair with digital health predominantly centers around health innovation and people connecting. So that's a bit of it. Today, as you know, I'm both the editor-in-chief of a large news platform called Medica Life. There it is. I invite everybody to read it. It's simple to find, medica.life. There you go. And we have some amazing authors, John White of WebMD, Michael Hunter, who's a great oncologist, Patricia Farrell, who's a psychologist, John Nosta occasionally writes for us, Christopher Nile, a whole slew of Hesham Hezbollah, who's an interventionalist, a critical care physician at Northwestern in Chicago. Some really amazing writers. We have really a whole crew of them. And I cover, obviously, topics such as health innovation, digital health, and environmental health. So what brings us together today is I've been privileged to write, over the last few years, a series of reviews on the Galleon Growth Reports. And Galleon Growth is a global consulting firm. They look at, I think, about 500 million data points, looking at thousands upon thousands of ventures, and they issue specialty reports for industry. I'm privileged to actually get these reports under embargo, and I get usually a few days peek see to review, and then with their blessings. But without their review, I get a chance to write an analysis of the report. And sometimes my analysis and their analysis differ, I might add. And I've been writing for quite some time that digital health was not in its waning days. Actually, and we can talk a little bit about that, what I saw 2 years ago. I actually saw from my private equity period what I'll call enthusiastic money jumping into the category, and particularly during COVID, popping it up, and then realizing digital health is a hard business. It's life science. It's not an easy business. You really need to know the landscape. And when that money kind of disappeared, everybody said, "Oh, that's it. That's the end of the category." I said, not at all, not at all. And we can talk a little bit about that, because I think we're really seeing the the full value of the category maturing. I think we're seeing a new sense of focus and value, and there's some very specific reasons why that's happening. And I would just say this is a really important category for the health ecosystem. With that, I'm going to stop.
Yeah, I had a good conversation the other day with a guest, and it just came up. Do you think it's too crowded though in the sectors? It seems like there's a lot of point solutions. Do you think that's been probably the problem of the most recent? Though it was, a few years ago, the cash was so easy. So, do you think that was another strain on the market with so many solutions?
Um, Well, before I answer your question, I just want to give Planetary Health First, Mars Next a plug. This is my second or maybe even third time I've been privileged to be invited onto the program. And I just want to say that people who are listening to this, I would follow Michael Mann and this show really closely. Michael, you have had on, I do follow you closely. You have on really a steady stream of exceptional guests of our industry who are expressing without really notes or preparation, expressing points of view and information that I think is critical to listen to. So I do tune in. I want to thank you for really bringing this whole program to a really heightened level. It's a must listen to program. You get exceptional guests, with the exception of me, perhaps, but you get some really wonderful people. And I just want to acknowledge you for what you're doing for the health innovation industry. Now, to answer your question, I think it's a really great point. And actually, this current version of the Galen Growth Report talks about consolidation. So I think to your point, it came out to a lot of people were entering into as innovators into the digital health sector because it was so easy to get a hold of money, particularly 2019, pre-COVID, just pre-COVID, and then especially when COVID hit, everybody felt they needed a digital health solution of some sort. For what reason? They weren't sure, but they wanted to have skin in the game. And I think that created an explosion of opportunity where I think a lot of these people who went in, they were innovators, most certainly. In many cases, they had an idea and they knew engineering. So they knew how to design something, create something. They knew how to tell a good story to get a hold of sufficient capital. Problem, they actually didn't understand the health ecosystem. So what you saw is a lot of people jumping in with an idea, and you'll hear this story. Tell me if you have. My father had this illness. My mom had this illness. My best friend tragically died from this illness. And I've created this because they had this problem. They didn't take their meds on time. They weren't adherent. They needed to get hold of their doctor. It was very patient-oriented, consumer-friendly, but they forgot one critical factor in their idea, which I learned during my private equity tenure. What's your business model? How are you going to make money? I mean, the idea aside, the need aside, we have to remember, particularly in the world's largest single market, which is the United States, we have a very clear reimbursement system, predominantly for the 65 and under private payers, for the 65 and older public payers, Medicare predominantly, for those with clear economic need, Medicaid, and then everybody's either self-insured or insured through a plan. Well, those programs have reimbursement policies, formularies. Who pays for digital health? Who? And they didn't think that through. They assumed, and this is the biggest thing they said, saves money. It will save money. Well, they forget there's an offset on save money. There's training, there's support, there's onboarding, all of that. They said this is going to be great for hospitals, saves money. Not necessarily. I mean, how about who's going to pay for that? The IT department of the hospital system has to staff for that. They have to deal with the cybersecurity of whatever it is. So they didn't really understand the system sufficiently. So you had a lot of companies jumping in all at once, not understanding the system, and suddenly investors, angel investors, people with little money, started to see failure rates, a lot of failure rates, and then the back off. And I think it was great for the category, Michael. I know that sounds really strange. I think it was great for the category because it helped people understand that life science is complex. You need to know it. You need to understand who's going to pay for it. And that it allowed the category actually to mature very rapidly. So I think that's the answer to your question. Yes, but there's some more complexity to it, which is it's all about who's paying for it. Nobody thought that through.
So I see on your report, your article, Chat GPT, AI. A lot of these things are more so functional improvement, efficiency play, not reimbursement per se. And maybe I'm overgeneralizing, but I think it can solve a problem, but efficiency play. Whereas digital health sometimes wasn't solving a problem in that extent because you're actually losing a health system or provider money. If that encounter would be more in person or whatever that procedure. So I think maybe that's an overgeneralization with the categories that's getting a lot of investment, but that's just sort of the buzz I've been hearing with AIs. A lot of these automations, a lot of the challenges with staffing or redundancy. So, but I also want to give you the opportunity. You wrote this really what I thought was a really good article, and the fact that to me it gets me excited because we're in this ecosystem. We want to know that there's innovators, there's startups, there's the last thing we want to hear is no one is investing in this space. That would be horrible. So tell me a little bit of what you see from a few years past, like you just kind of shared that, the trends, the numbers. What are you thinking is going to happen this year? Are we going to see a little more than we don't want it as big as the 1 year that it went, that would be too much. What would you think would be healthy for this ecosystem, and what are your thoughts from what you wrote on your article?
Yeah. First of all, I want to credit Galen Growth because a lot of my perspectives have been able to be refined through seeing the data that they publish, but not just this report. I can reflect back to years of reports where I'm able to sort of assess. And as I mentioned, I don't always agree with their assessment, but I do agree always with the quality of the data. It's extraordinary, considering the fact that it's global. It's looking at thousands and thousands of ventures. It is looking at at this point, hundreds of millions of data points. So I respect the data that they provide. And I think it's an essential tool, certainly for anybody who's involved in the category. But there's a few things you've mentioned, Michael, I want to unpack because I think you really banged the nail right on the head. Well, first and foremost, a few years ago, we were looking at a tremendous amount of technology that was directed toward consumers. This report has a new term in it. I really want to I use the term. You can get the whole report actually as a download by way of the article on Medical Life. They use a term called tech bio. I actually think the the term was really developed by a person, I would say, a much watched person, David Klein of Click Therapeutics, talked about it's a digital therapeutics company that mirrors a biotechnology company. The same clinical rigor, the same thinking process. David Klein, really, a few years back, I heard him speak at a HIT Lab presentation at Columbia University, probably about 2-3 years ago. It was so spot on. And he talked about the fact that companies involved in the therapeutic side of digital had to really become more biotech-like in their rigor. Innovation, technology, absolutely, but the clinical rigor had to stand up to the same quality as a BLA as opposed to a 510K. And I credit that idea to David, most certainly. He's a must follow. The concept that he brought forward didn't exist 4 years ago, 5 years ago. The category relied predominantly on, wow, I'm going to get a 510K approval and I'll go to market and everything will be great. And that was spot off target, off target. A 510K gives you permission to market It doesn't mean that those that reimburse have to put you on the formulary. So you can market all you want. It's really a question of who's paying for it. So that was off track a few years ago, and you could see that. You could certainly see that in the marketplace. You could see it through the reports. Tech bio, which Galen Growth refers to now, is a brilliant term because it says, look, you've got to operate at that level, at that height of clinical data, consistently generate proof data. Why? People don't talk enough about it. The reason is that the Center for Medicare and Medicaid Beneficiary Services requires data, great data, in order to even consider you for reimbursement on a government reimbursement level. And certainly private plans require that data too. So again, Click Therapeutics and David, the credit goes to them. I think they're the pioneers in that concept. But Galen Growth was talking about in the last two reports, data sort of rules here. The other aspect is you talked about AI, ChatGPT, Gen AI, and large language models. Let's face it, were we really talking about that 3 years ago? No, Michael? No, we were not talking about that 3 years ago. That's exactly correct. So what was happening is the category was centering around the engineering or the software, you could say, of the category, but not the practical application of the give and take of the market. Large language models allow health providers and patients to interact with data in a very specific way. Great example I've written about also on Medical Life is Dave AI. Dave AI is a cancer LLM created by a company called Belong Life. And think about a cancer patient. They have a relentless amount of questions. An oncologist doesn't have time to answer a relentless amount of questions. I'm talking about, like, I want to speak to you, doctor, for 2 hours. I mean, do you know a doctor who could sit with a patient for 2 hours? How about 20 minutes? It's impossible. Dave AI is programmed so that a patient who has a diagnosed cancer or not can actually just interact with Dave AI for as long as they want. That's a brilliant concept. And the programming is on an oncologist level, but speaking to the person at their level. That's the power of LLMs. Again, a person I quote in the article, I think is the one of the pioneer thinkers about the cognitive age is John Nosta. I mean, John was talking about this a year ago, and we just started to realize it. But if you have the ability to think, hopefully most people do, and ask thoughtful questions, LLMs can engage you and help. And so that's example. David, I don't know if that must be Dave AI. Okay, there he is. Dave AI is something very unique, and I think systems are going to mirror this sort of LLM, which makes it incredibly practical. Now, what does it do? It hones the patient's thinking process so that when they do get to see their clinician, cardiologist, oncologist, nephrologist, pulmonologist, whatever it is, they can come in with their questions refined at a higher level, and the physician can really begin to address. And that's the power of these technologies. They're extraordinary. So we didn't have this conversation 3 years ago. Now that's LLMs and ChatGPT is front and center. Next, a lot goes on during a visit with a patient. There's notes taken, there's coding. How does a hospital know that it billed for everything it could have billed for? The ability for this technology to scrape data and look at, you missed this code, or you missed this code, or you forgot to mention the fact that the patient has to come in a month. The technology, the large language models allow us to look at the office visit and say to ourselves, am I doing everything possible for this patient? So that didn't exist 2-3 years ago. Now it's front and center, and you see companies coming onto the fore that they're not saying, I'm going to save you money. Now they're saying, I'm going to make you money.
Mhm.
That's a whole different conversation that makes health information technologies more valuable. One thing I do want to say about Galilean growth, where I so agree with them, I sometimes disagree. Here, I totally agree. When we think of digital health, you know what we think of? We tend to think of apps, applications, right, on our phone or our different tools. We tend to think of the low end aspects of digital health. You know, Galen Growth really understands the totality of the category. I mean, it's dealing with remote patient monitoring, it's dealing with health information management, it's dealing with LLMs. The digital health category is vast. It's dealing with connected medical devices. It's really vast. What you have up on the screen right now actually are big, big categories that we deal with. But digital health is expansive. I would say if you think about everything today, even the ability to screen radiology reports, MRI reports through large language models and look at this in comparison to hundreds of thousands of other scans gives us much better diagnoses and uses the radiologist's time much more effectively to validate and look at anomalies within the screens that were impossible just with the human eye. So we once had people like this. It's hard to believe. We once had human beings that had this level of cognitive power. The problem is they're few and far between. These technologies, these new digital health technologies, have really excited the investment community and hospital systems. And hospital systems have established their own, essentially, business development groups or investment groups to scout out technologies that can make them far more effective in care, but actually help use their time better to generate more revenue. So you're right. You're right, Michael. It's a different game. The game we're looking at in 2024 is so different than 2022 when the market started to collapse in this category.
So it seems like this chat GPT, generative AI, LLMs, this is a leap. I mean, we're in a new, I mean, what would you call this? I mean, is this a new phase of technology innovation? It seems like even though digital health prior, I don't want to say it was analog, of course it was digital, but it seems like we're in this phase. I don't know what to call it. I know Galen has, different categories, but it seems like with this technology, it's really having us rethink about how we can get work done or reimagine things that were never even possible.
You know, Tom Lowry, who was formerly the national director of AI at Microsoft for Health, is one of these people I follow very, very closely. And Tom often talks about the fact that we've got to separate the aspirational aspects of digital health or AI with the practical aspects of AI. And that's always where my head has been. How do we apply the technologies? That's where the rubber meets the road. It's not how we want to think about them. So you ask, well, what is this? Well, one, we're constantly dealing with an accelerated S curve. And MBA
Mhm.
programs they talk about, and you obviously from your work in public policy and public health, we start something, all of a sudden it becomes like wow, 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 and then it kind of like tires out like any product line,
Mhm.
and it gets sleepy, and you can either go like to the bottom or reinvent yourself with another sort of curve up with the S curve. That's to some extent what it was happening with digital health a few years ago. It was really hot and interesting. We weren't seeing a lot of productivity and people were getting tired of it. And then boom, AI came on the scene with LLMs and ChatGPT, became a whole different ball game. So John Nosta has a term that I think is spot on. He calls this the cognitive age.
Mhm.
And and it's not just human cognition that I'm a big believer of. Humanity will control these technologies. Some will differ, but what I do think is happening right now is these technologies are getting smarter and they're playing into the hands of people who are comfortable asking smart questions again and again and again. That's why the patient who asks 100 questions is going to really be able to maximize this compared to the someone who asks two or three. So one, it's going to have to match our ability to use the technologies, and our ability to keep these technologies getting smarter and smarter, faster and faster. So I think a few things are going to happen. One, there is a bit of a lag time between how smart they are and the speed of science. So those systems that are able to absorb data very quickly and squeeze out what they call hallucinations, which means misleading data. If you can add data quickly, squeeze out the hallucinations as quickly, those companies are going to rise to the fore in terms of the smartest digital health technologies available to humankind. So that's, I think, where it's going to go next. Speed and scale. Speed of how we absorb new information, and the scale of that information, the wealth of the information, and then again, speed in terms of making sure the information is accurate and correct. So we're not acting on hallucinations, misinformation. So, I think we've got a lot of ground to go in terms of absorbing human knowledge into the system. The other aspect that I think I continue to worry about is the technology is getting smarter. Are we culturally getting comfortable enough to deploy it within the system?
Mhm.
So you see a lot of people who are just darn uncomfortable, or they rely on the technology to do all the work for them. How do you know it's accurate? I'll give
Mhm.
you an example. I asked OpenAI to write a biography about me, just out of the hell of it. I said, right, and I gave them some parameters. I asked them some good questions, and gave them direction. Um, I don't think that I'm a Marvel superhero. Certainly, to the best of my knowledge, I can be disintegrated by fire pretty quickly, but you really have to still maintain your own personal knowledge. So it's the combination of the doctor or the health professional maintaining their clinical acumen along with the machine learning getting smarter as well. It doesn't mean you abdicate your responsibility as a human and relegate it over to the machine. One last thing on this point I want to make clear. Where do we use this technology? Where do we use AI or LLMs? Repetitive tasks that really don't need a lot of thought. I mean, for instance, toll taking on the highway. How many toll takers have been replaced by essentially um, a little meter in your car,
Mhm.
right?
Mhm.
A responder. You don't need to wait online for half an hour polluting the atmosphere to give them your 50 cents.
Mhm.
That's all done by camera now. So we have to recognize that when we have repetitive tasks that don't involve a lot of unique decision making, guess what? The machine is going to be deployed really quickly. So, I think that we've got a lot of growth areas still with LLMs and ChatGPT. But John Nosta is right. We're in the age of cognition right now, as we were
Yeah,
once in the age of steel and bronze.
yeah, I do hope that there will be immense displacement. And I think there already is at the big technologies. They might not call them layoffs, but there are, with profit motives. I hope we can get to a point where there's more leadership to try to invest in countries and their citizens, their people. And yes, it's great to replace repetitive tasks, but I'm concerned about that as a solution. And we should be as a society that there are going to be some serious winners and losers. And it looks like a lot of with this technology, look at NVIDIA right now. When you look at the S&P right now, they're sucking everything up out of everything else. And at some point, there will be a cooling period. You can't go up forever. But the other thing that I think is really fascinating is really imagining or what this AI is, what LLM is, and I like it to the hybrid effect that I would like to see our little droids. Like you have your own assistant, and really I like it to with my father who's 91. Who, my gosh, if we could program it doesn't have to look like R2D2, but something that would help him. He's now requiring a ton of assistance where he would have a caregiver. We don't have enough caregivers. We're fortunate to have a caregiver, but there could be very close in the next 5 years. And they already Japan seems with regulatory much more open to robots or assistive devices, whatever. But this could be fascinating. I could think of that as a new age where my father could get to the shower. He could, never not using assistive device now, a whole thing that would help him remind him with his medications, make sure he's taking them, and then make sure he's safe and not falling. And that to me is really cool. And you see a lot of the Boston Scientific or, some of these technologies companies. And I just don't know if the price point's good enough yet for a healthcare, what kind of company would do that. But what that would look like. I don't know if
Yeah, look, these are important questions, Michael, that you're asking right now. First of all, God willing, you'll celebrate your father's healthy 100th birthday.
Well, he's
But
91. However, but anyway.
I'm hopeful. I'm hopeful. I'm hopeful.
Okay.
The reality is we don't have enough home health care, and those people who are dedicated to that profession, unfortunately, are woefully underpaid.
Mhm.
So on one hand, we know it's expensive to keep people in long-term care facilities and also in hospitals, and it's healthier at home, and it's mentally healthier at home. The challenge is many people who are home health aides are paid a bit above minimum wage. So that's a travesty of our system. We're going to have to address that in order to deal with this country's essentially zero population growth. We're an aging population, as is Japan, by the way, and that's why they're looking at that. The question of robots, though, is sort of smart programmed robots. I'll just say, I was in someone who knows digital health so well, mutual friend Ritesh Patel, who is really one of the great minds of digital health marketing. People may or may not know he owns three award-winning restaurants called Brick Lane Curry, one in New York, one in Jersey City, one in Montclair, New Jersey. And I was at the New York City one having lunch one day with an industry colleague, and along comes a robot to serve me my lunch. Seriously.
Yeah,
I
no,
mean,
I've seen them before. They have them at restaurants. Absolutely.
the robot didn't put the plate on my table. The waiter did, but
Mhm.
the robot was comfortably navigating the restaurant to bring my meal and my colleague's meal to our table. So we're on our way, right?
Mhm.
We're on our way to using people effectively, but we still have to remember that we have to care for humanity. I would not say that. That technology is going to replace humanity and that we have to worry about that. We're not there yet, and I hope we're never there. But I will say that humanity has its limitations. And one of the limitations is objective judgment about cases. I don't know about you in your life, but I know in my own family, which is pretty medically astute, there's been quite a bit of medical misdiagnosis at times that was resolved actually by our using technology to double check a diagnosis. So I can only say from personal experience
Mhm.
that AI and ChatGPT, Gen AI, large language models have a place in our households
Mhm.
as a way of making us smarter to engage the health system and saving lives as a result of our own lives.
Yeah.
I'll say that. Just to get back to the catalyst of our conversation, which is the Galen Growth Report. And I really appreciate your spotting the article immediately and saying, we got to talk. What I will say is this article in Medical Life and the report, which you can access through the article, really point to the revitalization of the category that
Mhm.
I feel was never on the ropes. Because we were judging it by the amount of dollars coming into the category and not looking closely enough to where the dollars that were coming into the category were going. And they were shifting to hospital systems were investing or technologies that would serve hospital systems. That was mission clear. and also smart medical devices. So just look, Michael, today to people who have blood glucose meters that are interfacing with insulin pumps, smart insulin pumps. I mean, that is really reducing hospitalizations, it's improving quality of care, and it's reducing costs, and therefore it is making the patient's life far more, or the person's life, person with diabetes life, far more beneficial. So we're seeing smart technologies. We're seeing the better use of remote monitoring technologies. We're seeing ChatGPT in telehealth. We're seeing hospital systems deploy these technologies to respond faster to patients and to look over medical data so that EMRs become something that doctors can use instead of something that they abhor. All of this is resulting from the digital health category. And I also think we're going to see life science companies realize that for every pill that they invent, every small molecule or large molecule they invent, they're going to need some sort of digital coupling to make sure that they're doing a good job and producing the outcomes that they want. So, I would say we're seeing not a renaissance of the category. I just think we're seeing now a very mature economic business model come to the fore. And I would say that the category now plays a key role in the future, or as a support system to medical devices, to pharmaceutical products, to the health provider system, to making home care and long-term care at home possible. All of that is due to this type of technology.
Yeah, I like how you reassess, you look at the digital health, the landscape, kind of the categories to help bring a better insight. I think it's always important because it's just numbers alone don't tell the story. I think that's really helpful.
Yeah, I think your shows, the guests you have on, are first, and I'm very appreciative of your inviting me back. Um, I think the guests you have on provide a deeper look under the hood of the health system. And that's why I said earlier, I recommend that people who are listening in to make sure that they tag you in your program
Mhm.
and follow it closely. You're not having the usual guests who are out to hawk something, sell something. You're having people who really understand the complexity of the system and are explaining what they need to know to make better business decisions. So, the kudos are to you of really looking for these guests. For me, also, I really want to tip the hat to Galen Growth, to the people
Mhm.
there. They really know their stuff. It's great data. And by the way, just for the listeners, I have no economic connection to Galen Growth. I don't get paid to write anything about them. They're not sending me even a free T-shirt or sweatshirt for my articles.
Mhm.
Although I would take a Planetary Health Mars First Next T-shirt when you make
I-
them. That's a cool logo. Um,
Thanks.
but Galen Growth is not doing that.
Yeah.
To me, it's a privilege to be able to see the data and to spend time with it and ask the analysts the questions I want to ask. But I would say all along, what we're seeing is not a economic correction. I think what we've done is separate the wheat from the chaff.
Mhm.
Wannabe players from the real people who understand the business model and understand the health sector. And I think the players who were there before are doing well. We have seen some surprises, though. I'm not going to neglect that. Olive AI, I think it was Better Health, Babylon Health. But that has nothing to do with the category. I can explain those quite clearly. Lack of differentiated model, not realizing that competitors can come in quickly and do the same thing, maybe even a little bit better without the pizzazz. I think that Babylon Health, which was a great idea at the time, didn't realize that other people could replicate this. Telehealth was not necessarily a, a sort of a business they could scale up fast enough and control. So it's not the category sometimes, it's the business model. And I think the Galen Growth model to me reaffirms that.
So we're kind of wrapping it up, and I really appreciate your affirmation with my show. I do try to continue, and I always will try to have, a robust, diverse group of, I'm always trying to do different topics, from mental health to, opiate use to, digital health technology, all the different things. And then just things that I'm interested in, people, speakers, and also relevancy, like you putting this, Gail, in which growth, which is a really pretty, I thought, very timely, since it is July. It's that point where we're halfway through, or depending on, I guess, corporate. I'm not a finance guy, but I guess it's the beginning of the year, depending on when
Yeah.
you do that. So I think that, to me, was a really big signal to do this now. And I hope that we can have more discussions. It's hard to find. I think people don't have any idea how hard it is in the self-publishing business, or whatever you call this, the podcasting, to constantly find good guests, good topics. And I do intentionally not try to do product pushes and that. I just don't think that's fair to anyone, to try to create good content, good conversation.
Goodness. Look, people have to differentiate themselves by their knowledge, and I think you have a very keen eye for people who have something to contribute to the community. I just want to say that we were at I guess it was Vive together in Los Angeles, and you occupied a sound booth there for quite some time. You had some amazing guests on. I was there for Medical Life, covering it and writing articles, interviewing people. I'm watching you from across my desk, bringing these people one after the other, great guests. And I'm saying to myself, hey, this guy's gobbling up all the people I want to interview. What's going on here? But you do a good job with that, Michael. I know that we won't see each other, unfortunately, at Health. You'll be there. We will see each other at Vive again in Nashville. That's the capital of the health provider world of the United States, hands down. But, as I said, I value following you very closely, and urge all the listeners to do the same. Whoever you get on, you vetted, and it's well worth our while. I'll just say this as well, that you have a very diverse understanding of our category. You have I think you have an MPH. You've looked at this from the reimbursement side, from the service side. So your experience as a podcast host in health is built on the foundation of your knowledge of the category. So for me, whenever you say, hey, would you come on my show, I'm just honored. I got to tell you, thank you very, very much.
Yeah, no, I really appreciate it. And I appreciate everything you do, Gil, to keep the community going, everything your network, your people, and what you're writing, and what you're doing. It's really, it's so important to surround yourself amongst and around the right people. So, and I'm sorry I won't see you at Health, but I know I'll see you at Vive. And thanks for letting me know. I didn't know it was at Nashville, so that's cool. It's closer than Los Angeles. So
it's certainly. And by the way, just for the listeners, I know that you and I had a fun session. I think it's going to be airing pretty soon on distributed from Healthcare Now Radio. But you, Todd Yeary of Pharmacy Podcast, and I got on a call not too long ago, and just decided to dive in and talk about the pharmacy world together. And I think that's airing soon. I'm really looking forward to revisiting that fun experience.
Yeah, no, that was awesome. And I hope we can do some more. We'll have to talk offline and come up with some, something cool. I don't know, a cause, or collaborate with some other, there's so many great events, people doing great things. So I hope we can we'll definitely do some more.
Let's do some planetary health first.
We'll get to Mars next week. How about that?
You got it, my friend. Good.
All right. Gil, it's been awesome.
Always great.